Hi, everybody. Welcome back. It's Wade and Thomas with the Setter Tales podcast. And, tonight we're going to talk about a subject that I think all of us have experienced. Anybody that's hunted dogs for any period of time has run into one of these issues with their gun dog health or any types of dogs. And so we have Dr. Ryan Steen from Frey Pet Hospital in Cedar Rapids on as our guest tonight. And for full disclosure, Ryan has been my vet for probably 15 years, so he is the official vet of Sweet Point Setters. But just a nice facility, and they do a lot of great things there, especially with orthopedics and some other things with dogs. And so it's going to be a great opportunity for anybody that's listening. If you've got questions for Dr. Steen and want to drill down a little deeper in some of the subjects that we're going to be talking about, be sure to text your question in to us, and we'll see if we can get it answered. What do you
Yeah,
think about
and
that?
even if it's not exactly an orthopedic question, any dog health question, I'm sure he'd be happy to
Oh
answer.
yeah,
And
yeah,
yeah, we're excited to get him on here.
yeah.
How
We're
was
gonna.
your fourth?
Well, there's another topic: dogs that don't like fireworks.
Yeah, yeah,
Yeah, it's one of those crazy things that I've never ever quite understood. But a hunting dog that can be out there and be shot over all day long with a shotgun, but firecrackers is just a whole different thing for them. So
yeah. A lot of the issues with that is you're in a more of a controlled situation. They kind of know what they're doing out there.
yeah,
They're excited. You get a dog in the house and it's quiet. They can maybe hear the TV going, and then kaboom! It's like, what was that? We're not hunting. What was that noise? And one of the issues of that, and I explained that on my Facebook page as well, and is the way you reinforce that behavior. So a lot of people pet the dog, hold it, it's okay. Well, you're just reinforcing that dog to be scared. So, there's probably still some fireworks celebrations yet going on. There's still people shooting them off because they didn't get them shot off, whether weather or they just bought too much. So, you know, dogs are an animal that like to be, or just like a pack animal, like a wolf or a coyote or a fox. When they get scared, they go to a den. So if you can get that dog a nice quiet place and just kind of let that dog be itself, maybe in its kennel, you know, teach that reinforcement of being in the kennel, they're safe. And that's kind of my pro tip is when you reinforce a behavior, you can do it by saying, "Oh, it's okay, Fluffy," or whatever, but we have to be careful of that. So I know a lot of people you look on the lost pet sites right now and the community sites in big cities, small cities, anywhere. Oh, my dog ran away during the fireworks. Don't put them in the situation where they can just get out of the house, run away, or have them run around the lawn. You know it's 4th of July.
right.
You know what's going to happen. Be prepared with that dog. And that's a big thing that people need to realize. And even if you're hunting, if you can do all the training you want, that dog's got natural ability, it's going to point, but until that gun goes off in a situation that they're not ready for,
Yeah.
gun shyness is man made, and you have to approach it. You have to look at that dog's threshold and approach it correctly. So, I think we have Ryan in the
Yeah,
room. We
yeah,
can
we're
get him
gonna
on
get
here.
we're gonna get Ryan with us, and Ryan, we appreciate you coming on. How you doing tonight?
I'm good. Thanks for having me.
We're going to dig into a lot of different subjects, and hopefully, we're going to have some of our audience is going to see some things and want to talk to you a little more about following up with some questions. But I think as a place to start, obviously, you and I have known each other for a long time, and we've had a lot of different we've had some barbed wire incidents. We've had I had a raccoon situation. We've all had that. But just your general health and upkeep of dogs that are working dogs, that are, especially during the season, are working pretty hard, multiple days a week. And those are some of the dogs that we bring you and when we have issues. So I guess as a place to start, though, we want to talk a little bit about your expertise in some of the orthopedic side of it, and just how did you get interested, I guess, in veterinary medicine, and where did
hmm
that all start for you?
I grew up, on right on the edge of town, so we kind of had the best of both worlds. Grew up in a little town called Mechanicsville, and so I had cattle, we had a couple horses, and I showed calves in 4-H, and I was had a great uh, veterinarian that came out to our house, Doc Ed Spear, old Doc, and I was just always enamored with that world, and that's what I was going to do. I was going to become a mixed animal practitioner. I was going to have a red truck with the vet box in the back, and just go from farm to farm. And then I got into veterinary school, and I started working the summers and Christmas break for Dr. Dean Frey, who our hospitals, who started our hospital, and kind of got the bug a little bit for what he did. He did a lot of surgery, particularly orthopedic surgery. He was an exceptional veterinarian, and really dove into things that the people would send him cases from all over, but other veterinarians would, because the things he would tackle. And so then going through veterinary school, I kind of went both tracks and had the option of doing both, and got my senior year and decided to go the route of small animal medicine. So then when I got out of vet school, Dr. Fry was really, I graduated veterinary school on a Saturday, and on Sunday night I was on a plane to Ohio State University, the Ohio State University, as they say, and to take advanced training in orthopedics. And so I hadn't worked a day in his clinic as a veterinarian, and he was already sending me off to get some advanced training. And then I got to learn under him for 3 or 4 years before he retired, and I bought his practice. And so that's kind of how I got my start.
Now, typically, what are some of the injuries or some of the procedures that you commonly see there at your practice?
Yeah. The most common injury, by far, is ACL tears, or in dogs, it's technically called a CCL. Probably most people who've got hunting dogs, really, it's just a remarkably common injury. And approximately a little over 50% of dogs who tear their ACL or CCL in one side will tear the other side. So I do about 100 and somewhere around 150, 160 ACL surgeries per year. And then the other surgeries that I would do, I do a few hip surgeries, and then patella luxation. So, like, a lot of people know that as like a floating kneecap, where the kneecap pops out of place, would be another common one. And then our situation is a little bit unique. So about 80% of what I do is orthopedic surgery, and then the other 20% is just generalized, just medicine, just more typical veterinary medicine. But as far as injuries, it'd be knee, hips, occasional, shoulder, elbow, particularly in shoulder, maybe in younger dogs. And I tackle a lot of those things, but I also kind of pride myself on knowing if there's something that's that maybe should go on to that next level. There are orthopedic specialists who are better than me, for sure, and I take pride in kind of recognizing a case that, okay, that one probably is a big enough train wreck. It better go to a colleague of mine in Des Moines or Iowa State University.
Okay. And for hunting dogs specifically, we talked about, jumping off tailgates, and those injuries can kind of come in all different ways, I suspect. Probably.
Yeah, and the hunting dogs, obviously are athletes, right? And not only that, they're athletes who are not in a very controlled setting, as opposed to a human athlete who's on a track or on a football field, or where the footing is pretty precise, and the conditions they're going to be in are uniform. For these hunting dogs, of course, they're in all kinds of terrain, and much of it unpredictable. And so you can have those fluke sort of, incidences where they, step in a hole or hyperextend jumping over a creek or what have you, or injuries like we talked about where they get into barbed wire, that kind of thing. But specifically about the orthopedic injuries, there's plenty of terrain where they can get themselves into trouble. Uniquely though, with the most common injury I see, which is the ACL, and again, technically it's called a CCL, but most people know it as ACL because that's what it is in people. But in ACL in dogs, That is, it can occur like people, a person tears their ACL, it's like that. I mean, it's perfectly fine, and then they hyperextend and it tears. And in dogs, it doesn't usually do that. It may appear that way, but most of the time in dogs, it's a it's a repetitive. They'll tear a little bit. They may or may not show symptoms. They'll tear a little bit more. They may have a little bit of lameness that kind of resolves, tear a little bit, and then it finally goes. And so, a lot of the dogs that I diagnose with cruciate disease, I would say most of the dogs that I diagnose with cruciate tear, we'll see changes on the radiographs, on the X-rays that are 3-4 months old, because it started way back when, and that's often surprising to people, because they would comment, no, he just started limping yesterday, and I believe them, but the injury didn't start yesterday.
Interesting. What, and then you said, does the dog start favoring that side and then causes injury to the other side? It's like a
Yeah,
human
it's
might?
multifactorial. So when you got 55% of dogs who tear one side and then tear the other, certainly wear and tear is part of that, and the fact that that they're lifting up one leg or limping on one leg, they are putting more pressure on the other side. I used to, up until about 5 years ago, I would say to people, a dog would come in, maybe they're three-legged or they're limping badly, say on their right hind, and I would say, well, we need to, the sooner we get this side fixed, the less likely they are to tear the other side, because that makes all kinds of sense, right? But there's been a couple really large studies that dispute that pretty clearly, actually. So it turns out that that's probably overstated. That it comes back a lot more towards genetics and weight, et cetera. So the type of surgery that was done on the first side, the timing of the surgery on the first side, had no bearing in these two large studies on whether that second side would go. Which really, really, questions then how much of an impact is that limping doing? If it doesn't matter how long they do it, how big of an impact is it having on the other side tearing? For the first time, and this is fairly recent development, a genetic test has been identified by University of Wisconsin, to identify dogs who are at risk for cruciate tears. And I believe as of right now, I think the test is only for Labradors. They're working on genetic, they got it on the genetic basis of for other breeds. So I believe as of now, it's just Labradors, but that's kind of a really remarkable finding, so that they can do that. But it is not, most genetic tests, they're looking for a single DNA genetic marker. And this test that they're looking, it is impacted by multiple genes. And so there's sort of an algorithm they've developed to find out whether a dog is at high risk or low risk for cruciate disease. But it just kind of goes, that's probably a long-winded answer to, that it's not just something as simple as just lifestyle, right? I mean, there's a lot of factors that go into a dog tearing their ACL.
One thing I know would probably, the question was going to be asked was, is there any testing for that? But is there like I know you said Labradors and there's issues with that, and I won't go down that road with the number of Labradors in the world and all the breeders, but is there something like, as far as frame, weight, size, is a dog that's, obviously a dog that's a little thinner and kept in shape is probably going to be a little better athlete, may not tear something, but they could, because they're wild and go like hell. But is there something that, when somebody's picking out a dog or something, when they look at the parents saying,
Right.
the dad's a 80-pound dog and the mom's a 40-pound dog,
Right.
you're probably going to get that 50 to 60-pound range.
Right.
Maybe you'll get some smaller dogs since the female.
Right.
Is there correlation in between the size of, like that?
Yeah, we often, like, I might have somebody whose dog tears both sides, right? And then they go to get a new puppy, and they often ask, what can we look for? How can we avoid this? And the short answer is, there's very little, okay? Very little to look for that can help you. I mean, we see ACL tears in every size dog. Now, it is more common in larger dogs. But we see, I mean, I do ACL surgery in a 5-pound, 10-pound dog. I mean, any size dog can do it. Now, the studies that we were just chatting about, that looked for the incidence level on the other side, timing. We talked about the timing and the type of surgery didn't impact that, but weight did. So dogs who were overweight are dogs who are overweight are far more likely to tear the second side than dogs who are lean. And so obviously dogs who are overweight are far more likely to tear the first side, okay, than dogs who are lean. Now that doesn't mean lean dogs don't do it, but weight is a huge factor. So I think more so than what people can look for when they're picking out a puppy, where they really can have an impact on this is keeping their dogs in good body condition and not letting them get too heavy. Because that's if you have a dog who's too heavy and really active, I mean, now you got, now you're in a pretty high risk level.
And I heard you say like shoulder injuries in young dogs. What is that? Just because of their development and
Yeah,
being
really
overactive?
Yeah, there's a couple ligamentous injuries, like a biceps tendon injury or an infraspinatus injury, where we see that in adult dogs. But the most common shoulder injury, and injury is probably not even the right word, shoulder condition I see is in growing dogs, where there's a condition called osteochondrosis, and it'd be like an 8, 9, 10-month-old dog that's showing lameness, typically on one side. And what osteochondrosis is basically just it's a developmental disease, and there's a genetic factor to it where they basically get a cartilage flap that sort of just peels off up there in the shoulder, and it causes pretty distinct lameness. And so you have a 9-year-old lab or 9-year-old large breed active dog come in limping on one side. That would be really high on our list. It's a real challenge to find it. Okay, to diagnose it, it's really challenging to see. You often take multiple images from different angles to see that little flap in there on the X-ray. But that would be the most common shoulder issue we would see in younger dogs. We do occasionally see some biceps tenosynovitis in adult dogs, and that's shoulder injuries are like people. Shoulder injuries are challenging.
Now, as far as puppies go, and we talked about growth rates and that kind of thing, is that something that you see in your practice some?
Yeah, we just, a lot of the musculoskeletal diseases we see in young dogs, certainly genetics play a role, but a lot of what we see are dogs who are just growing too fast. And that could be because, this would be a question you ask 10 vets, you get 11 answers, but I usually have people switch to adult food at 6 months, just to kind of try to slow down that ration. And because you'll see on the bag, or, some breeders will recommend feeding them a puppy food for full 12 months or even a little bit longer. But I really encourage people to pull them back to to an adult food at 6 months to really try to slow things down. Because in my experience, that's a big factor when it comes to growth, musculoskeletal disease in young dogs, is they're just moving along too fast with their growth rate.
Now, if you have that problem in a young dog or a young puppy, then is that correctable, or how do you approach that from a treatment standpoint?
Some of them are. Some of them, if you just slow things back down, they'll just self-correct. Some things, can have some long-term impact, right? Where that may mean that they may have more osteoarthritis later in life, or so I would say it's kind of a mixed bag when it comes to that.
We, one of the things that in the hunting dog world, we talk about HIP certifications and breeding dogs, and I know that you do some of that.
Mm-hmm.
What can you tell us about that process and how that's done?
Yeah, so there's two ways to essentially certify hips and in dogs. One is called Penn Hip certification, and that's a really objective approach, where there's a distracting instrument that's put in between the legs, and that you get actual numerical measurements. Okay, for whatever reason, that has, I'm a fan of it, but for whatever reason, is not really grabbed on in the canine world, and so you don't hear a lot about it. The much more recognized in the canine world is OFA certification, and that we do a ton of those. And that actually, you can have OFA certification of a lot of things, not just hips. You can have OFA certification of elbows, eyes, thyroid, that's a blood test, patella in the knee. So there's actually several different things that can be OFA certified, but what people are most familiar with is the hips. And that's where we, typically sedate the dog. We're getting x-ray images of their pelvis. And then we are submitting those. They need to be, they're very precise as far as what information needs to be on the x-ray, but also the positioning on the x-ray. And I think we even maybe have an x-ray of an OFA hip view. And then those x-rays are sent in to the to OFA, Orthopedic Foundation of America. And they then take that x-ray, and they submit that to 3 different board certified radiologists. So there you can see that's a OFA hip. So just a very straight view of the hips. This view normally would have a little bit more down in the knees, but I had to cut that off to take out the client information. But that just kind of shows you how straight they need to be. And then you have 3 different radiologists evaluate those hips and score them essentially. Okay. And so that's a bit more subjective. And there's some criticism of that. I think generally speaking, they get it right. I mean, particularly doing a really good job of knocking out hips that, it's a dog that definitely shouldn't be bred because their hips are really poor. Right. But there are, there's some wiggle room there. And there's been some tests or studies been done, like where they actually sent the same images to the same radiologist, 6 months apart, and they scored it. That radiologist scored it differently, even though it's the same person and the same x-ray, because we're all, nobody's perfect. Right. And you're talking about an opinion and a subjective thing. But the idea is that if you have 3 specialists scoring them independently from one another, that they're going to get it. They're going to generally get it right. That's kind of the idea behind OFA. And I think in general, it does a nice job of kind of taking out of the breeding line, you hope, dogs who are more likely to pass on, poor genetics when it comes to hips. But genetics are complicated, right? And you could have, and I've seen it happen where you have 2 dogs that were scored excellent hips. Okay. And I see the x-rays myself. Those are both, the male and the female have excellent hips, and they might have 99 puppies that have beautiful hips. And they may have 1 puppy that doesn't, right? And because it's right. just genetics work that way. Now, if you breed together 2 dogs with poor hips, it's not going to be 1 out of 100. It's going to be, 80 out of 100 or whatever. So it's still helpful, but you can do everything right, and still sometimes things don't go right.
Mm-hmm. And a lot of that is, there's an age limit on that as well too, right? So I can't bring in a 6-month-old puppy and have the hips certified. They have to be a certain age, correct?
That's correct. You could get a preliminary reading, but it's not the official. They have to be 2 years of age to have OFA, to be OFA certified, because in theory, the hips are still changing, right? You can have them OFA certified any point beyond 2 years of age. But the only thing you can do before 2 years of age is sort of that preliminary reading that really isn't, it just gives you an idea, but it doesn't have any real value beyond that.
And if I recall, in female dogs, the heat cycle has an effect on the response.
Yeah, that's correct. Yeah. Interestingly, when females are in heat or have recently been in heat, there's more laxity in the hip. And so they can actually score more poorly than they're truly, it's not necessarily a true reading of what their hips look like. That's correct. It just kind of goes to show how complex that whole thing is. You wouldn't think that would matter.
No, you wouldn't. But I know we talked about that at one time when we were doing a couple female dogs that we certified. But about how many of those certifications do you do a year, do you think?
Yeah, that's a good question. It seems like a lot, but that said, there's not boatloads of breeders either. Right. So, maybe 5 or 10, something like that. So I probably, maybe, I don't know, maybe 1 a month, something like that.
What other things, as far as, we as hunting dog guys, what other things can we look for or should be aware of when it comes to joint health, I guess, for our dogs? I mean, obviously, as they get older, that becomes probably more of an issue, but is there anything specific, any supplements, any kind of thing that
Hmm.
we should be doing along the way to
Yeah.
help that situation?
Yeah. I mean, the nutraceutical industry is massive in both veterinary and human world. And that's a little bit of a dicey world because you don't really have to show effectiveness to sell something. You just have to show safety. I mean, glucosamine chondroitin supplements, and there's different versions, of course, some with MSM in them and those kind of things. But essentially, glucosamine chondroitins. I mean, there's a significant number of studies that show that those are beneficial to joints. Now, there are a few studies that question how much. And again, that's even in the human world. I got a buddy who's a trainer, an athletic trainer, and he thinks they're worthless. Okay, but I will tell you that I don't think they help every individual, but I've had dogs that people report back that they see better mobility in their dogs once they start them on them and that kind of a thing. And so I am generally speaking a fan. I think it gets overstated a little bit how much good that glucosamine chondroitin can do. I know this. They're safe. Right? There's just not a whole lot of. There's just not much downside, and so I think starting an athletic dog, maybe not right off the bat, but once they get into middle age or even a little younger, starting them on a glucosamine chondroitin supplement, I think is a reasonable thing to do. How much help it will do, I can't say with certainty, but it's not going to hurt. Um, they're often advertised in foods. And I will tell you that other than one food, there's one prescription food made by Science Diet called JD has got data that shows they can deliver adequate levels of glucosamine chondroitin. In fact, excellent levels of glucosamine chondroitin to help joints. Other than that, I would stick with a supplement. I mean, it doesn't hurt to have a food that says it's in there, but I think it is very, very difficult to deliver high levels of glucosamine chondroitin in food. The other thing that there's some newer information and pretty reliable information that omega-3 fatty acids, fish oils, also are beneficial for the joints. And of course, those have a lot of benefits outside of the joints. I mean, heart health, brain health, coat, skin, etc. So I think a fish oil supplement for your dog is a good idea.
I think we have a question for you, Ryan.
Okay.
Yes, Chad Chase writes, do you feel that with OFA, we would be better off with a pass or fail type of rating instead of the excellent, good, or fair, or fail? Because at the end of the day, with being subjective, they can be off some. The pressure applied to straighten the hip, and I have to push that away to read the rest of it, to straighten the hip, the folks reading and scoring the hip, just wondering your thoughts.
That's an interesting question. I haven't thought about that very much. I think there's merit to that thought process because I do, there's the gray area kind of exists in the rating, in the excellent, good, fair. That's where all the gray area is. I think we could all agree that a dog with poor hips, I think we could all agree that dog shouldn't be bred, right? And I think we can all agree that a dog with excellent hips, you should have the green light. The good and fair is where it gets a little dicey, and it's like, and so the only concern I would have with the whole pass fail thing would be who gets to decide where that line is, and how do we how would you even really? I mean, I guess you would say anything good or excellent would be you breed and would be pass, and fair and poor would not be that way. But I can tell you, I have had a situation where I had a dog who scored fair hips, and the breeder was really, really torn because this dog had a lot of other genetic qualities, okay, that that made them feel like it was a good idea to breed the dog. And I actually called and talked to the radiologist who scored the dog fair to kind of say, is there any wiggle room even on what you would say about these? And what do you think these hips are going to do as they get older, et cetera? Or what do you think the likelihood of them passing this on and that kind of thing? And of course, they don't know the answer to that. But even that radiologist commented to me that that they did not feel that fair hips alone were enough to knock a dog out of the genetic pool if it brought so many other things alternate qualities that you could have, that a dog could have enough other qualities in order to essentially overcome that, especially if it was bred with a dog with excellent hips, if that makes sense.
Mm-hmm.
So it's an interesting question, and I don't know that I have that. Maybe that was a long-winded answer to say I don't know, I guess.
No, I think that was a great answer. And people just, you have to trust the breeders that they're going to be responsible of this too.
Right.
I kind of preach on my soapbox a little bit with irresponsible breeding, and people to say, especially hunting. My dog flushed a pheasant yesterday. Yeah, mine retrieved one the other day. We should breed them.
Right.
And just knowing, been around dogs my whole life, I can tell, even when they're little, at 4 months plus, that dog's got bad hips.
Mm-hmm.
And I think it's just something that we have to, as not just you, that's your job, but
Right.
as guys like Wade and I that have dogs and probably going to breed my dog someday, and you've had puppies that, as hunters and dog owners, we have to be responsible on that. We do have another question.
Yes. Tom Hedenworth asks, what is coonhound paralysis?
Okay, so coonhound paralysis is actually in the category of what's called an autoimmune disease, and it's essentially where the immune system attacks the peripheral nerves, the sheath around the peripheral nerves. It gets its name because it's associated with raccoon saliva, which is strange. However, it doesn't have to. So not every dog who gets coonhound paralysis has been in a fight with a raccoon, etc. So it's essentially an overreaction by the immune system, or like an overreaction or inflammatory reaction against the immune system, the peripheral nerves, the immune system overreacting and essentially causing an overreactive immune reaction to the peripheral nerves. I jumbled that up. I've seen like 2 cases in 22 years, so I'm not an expert on that, but that's the gist of what it is. It's not very common, at least not in my world.
Well, I have coon dogs or had coon dogs, and luckily, knock on wood, none of them have gotten it. But I have heard about bird dogs because we get into the raccoons in the grass and they fight. So I've seen it and it attacks their nervous system. So that when they get it, they're down. And I've seen dogs pull through it once or twice. We've had one. My buddy's had one that's had it twice, and he's pulled through.
Wow.
So
the frustrating part about it is there's just no real treatment for it, and other than just supportive care. You're depending on the severity of it. Keeping these dogs hydrated and adequate nutrition, et cetera, and trying to manage the pain associated with it is the hallmark of therapy. And then they got to survive it. They got to get through it.
Yep. One thing I know is the big one that I see debated on every hunting site, every dog site is dew claws. Now, my thought, on my opinion, is that if you get it while they're young, excuse me, in Iowa, we're down south, the guys I know, some of them don't cut them. They think it's a natural thing, so leave it. I see in Iowa people that don't cut them, or they have cut them and it was a poor job. You get into that deeper, crustier snow, you're talking injuries, you're pulling them off. Some people say, don't cut them off. You're affecting the whole leg all the way up to the hip or to the shoulder. I guess, what are your opinions on that?
Well, I don't think removing them has any major impact on, the rest of the leg. At least my opinion is it doesn't. But I do think, and I'm pretty confident, I do recall reading an actual study on this where, the question I think that the study was trying to answer, is it necessary, right? And essentially the outcome of that study was that in most cases it's not. The dew claw injuries on dew claws that are tight, right, that are just normal dew claws, that they're essentially no more likely to be caught or injured on something than on any other toe. And so it's sort of a solution in search of a problem. So that's my general thought process. Now, there are times though where a dog has very loose dew claws, where I do think that could become a potential problem, where they are out running and they're going to get it caught and ripped on things. And I have seen that happen. So what I generally tell my clients is that, I recommend removing them if they're loose and leaving them alone if they're tight. But keep in mind, I'm seeing these puppies when they're 8 weeks old. The decision that breeders are making are when they're 3 days old, right?
Mhm.
And it's pretty hard to tell. I mean, I suppose if it was really bad, you might know, but a lot harder for them to know. So my general opinion is it's most of the time unnecessary. That'll probably make somebody mad. I bet somebody
Well,
probably.
Well, we've got dogs both ways. I mean,
Yeah.
we got a young dog that was a few months old when we got her, and she had not had her dew claws removed, and so there's a there's a kind of a window in there on that for a few days
Well,
or a week.
yeah, if you're gonna do them, yeah, like usually like 3 days is when they need to be done if you're gonna do them that way. I mean, we can remove them at any time, right? I mean, a lot of times if I might have a dog that's got really loose dew claws and maybe it's a dog that's gonna be neutered or spayed, and then okay, well, when they're under, we'll just take care of those. And but they're not very much fun to deal with afterwards. I mean, dogs are dogs are really want to get after those incisions, and so they got to wear the cone that everybody hates. And so it's one of those things where I- I'm fairly indifferent to whether a breeder is going to be doing it or not. But if I have a client come in to see me at an 8-week-old puppy, it's very common for me to have to say, well, they didn't remove their dew claws, now we got to do that. And if I look at them and they're tied, I just tell people I wouldn't bother with it. It's unlikely you're going to need to.
okay. So really, there's no benefits to doing it, or there's nothing against doing it as long as you do it early enough.
Yeah. I've never seen, I guess for me personally, I've never seen I've never seen a dog have problems because it was done.
Okay.
I mean, I maybe can recall once or twice having to clean something up a little bit that maybe they didn't get it all. And now it's got a little burr there or something. And so we need to go clean that up, which we can do. So I don't think it's anything to lose any sleep over. If a breeder is doing it, I don't have any problem with them doing it. I think it's not going to cause any, generally speaking, not going to cause any harm.
Well, you
It
kind of
just may be unnecessary.
you kind of gave away my next question
Uh-oh.
on the spay and neuter. So
Mm-hmm.
when you suggest doing that, as far as age wise, is it safe to do it, as soon as they're of maturity, like a male once his testicles do drop?
Yeah.
I mean, obviously you have to wait for that, but do you
Mhm.
want to wait till that dog's fully developed in its size, or does that not bother anything?
Yeah, historically, like in veterinary medicine, it's been recommended to do that at 6 months of age, and really no one knows why. I mean, that's just kind of somewhere along the line they decided 6 months of age is when you should do it, and that's what all veterinarians just spew that. But now there's newer information, and I guess it's not new anymore because it's been a few years where, spaying or neutering, particularly this is in large. I would say this is true in large breed, medium to large breed dogs. Spaying or neutering them at 6 months of age or younger, those dogs do have increased risk of joint injuries, including ACL, which we were talking about earlier, and some cancers. And so that now, unfortunately, the main study that was done on, it was golden retrievers, and it was compared against dogs who were spayed or neutered at 2 years of age. So we were comparing dogs at 5 months versus 2 years of age, and there's a big gap in there between. The general consensus right now, and this could be a question if you ask me 2 years from now or a year from now, I might have a different answer depending on what new information comes in. The general consensus now would be to wait on a medium to large breed dog, to wait till about 10 to 12 months of age. Their growth plates are pretty well closed by that point, or closing at that point. So their growth is essentially finishing up. And so the thought process is, in medium to large breed dogs, you're not in that increased risk category if you wait till then. So we are at our hospital, we recommend medium to large breed dogs waiting till 9 to 12 months of age, small breed dogs still at 6 months.
Yeah, that's a couple of questions I got pre-asked by a couple of friends to bring up. As far as therapies, if you see like a ACL injury in a dog, or it's prone to it, is there any like chiropractic care or anything like that that would be beneficial to an active dog, especially like Wade and I have? We hunt 3-4 days a week at
Yeah.
times when we can. Is it okay to keep that dog in chiropractic care their whole lifespan, or do you want to wait till they're fully developed before they do that? Or is it
Yeah.
beneficial?
That's a tough one. That's I think, and even the human side, if you ask people, yes, doctors about what they think about chiropractors, you start open a whole conversation. I certainly don't think chiropractic care hurts at all, and I do think I've seen it help my patients before. I don't do it, but I've seen there's some area veterinarians that do it, and I've had dogs who have injuries or neck injury, back injury, et cetera, that have seemingly responded really well to chiropractic care. So I'm a fan of it in the right situation. I'm not personally aware of anything from the standpoint of preventative medicine that would be likely to prevent injury, et cetera. I couldn't say it doesn't, but I'm not aware of any studies that show it does. I mean, the problem with ligaments, particularly like the ACL, there's no way to make your ligament stronger. It's why in the human side, you just, a long time ago, they hardly ever tore their ACLs. But as over time, athletes they're more powerful, their muscles are bigger, they're stronger, bigger, faster, but their ligaments aren't necessarily getting stronger. And so they're putting more and more strain on those ligaments. And so we just don't have any way to make we can't do anything nutrition wise or training wise to make their actual ligament stronger. It is what it is.
And once you do that repair, then what's the expectation of that dog's hunting ability afterwards, I guess? Does it
Yeah.
depend on the dog?
Yeah, and it depends a lot. We talked about a lot of these dogs have some secondary changes because it's been going on for a little bit longer than people realize. And so I think the big factor with that is there arthritis in there, because we can't fix that. Okay. And so if you have a dog that has severe arthritis, their prognosis is not going to be quite as high as if you have a dog that's got a nice clean knee and it's a relatively fresh tear. And of course, much like our discussion about OFA and the excellent, good, poor, there's a lot of levels in between those two, right? I mean, there's a dog that has very mild osteoarthritis, but there is some there, moderate amount or severe, et cetera. I generally tell people almost everybody asks, what should be our expectation with surgery? And I generally tell people we can get them back to about 90% of what they were before the injury. There's, one study I saw that showed approximately 20% of dogs after ACL surgery still have a little bit of a limp. I don't, I probably, just have tried to forget about mine that have a little bit of limp. I don't think it's quite 20% that would have any limp after surgery. I certainly have we have plenty of dogs that people just swear they're back to normal. But I think if you did like force plate analysis and really analyze things there, most people that have ACL surgery would tell you that knee's not ever quite the same. So we can get them back, but in most cases, almost every case, we can get a dog who's a hunting dog back to that, a field trial dog or a hunting dog. We can get them back to that athletic performance. They may not be, but they're rarely, they're just not going to be. It's like a person tears their ACL. You got some that it ends their career. Most come back and compete, but they're not quite the same. And then there's occasional Adrian Peterson who's better than ever.
What's the recovery time period for that?
Yeah.
When you have the surgery from when the dog can get back in the field, for instance?
Yeah, a little bit of variation dog to dog, but the real restrictive period of time is about 2 months, 2 to 3 months, where they can't be running or jumping. They just have got to be on a leash or confined to a small area at all times because the repair is healing. They can go for leash walks during that time, but they can't be running or jumping. Once we get past that point, now we can start, acclimating them back into activity. But I generally wouldn't have a dog. I typically again, different opinions, different surgeons, but it'd typically be about 4 or 5 months or maybe even up to 6 months before I'd really want them going through, rough terrain and back at it full bore.
And you had mentioned that some of the new techniques that you've got going on there with some treatments, stem cells, we mentioned that. Can you tell us a little more about the stem cell things you guys are doing there?
Yeah. Yeah, and it kind of mirrors the human side. You just hear more and more about stem cell therapy, and it's actually what we do more of than even stem cells, PRP, which is platelet-rich plasma. You hear a lot about athletes. I think like Eli Manning maybe Tiger Woods had PRP therapy done. I heard a little bit about that when that was done. And that because it's a little bit less expensive and certainly less invasive. So with stem cell, we harvest stem cells from adipose or fat tissue within their abdomen. And then that goes through a process, and then those stem cells are injected back into the joint. So that's a multi-phase thing. You got to do the surgery to get the stem cells and then come back later and put them back under and to inject the joints with the stem cell. PRP is kind of a one-day deal and a little bit less expensive, where we're drawing a blood sample, we're harvesting that platelet-rich plasma, and then a couple hours later we can inject that back into the joints. In both cases, it's been found to the difference being that stem cell just lasts longer. The effect lasts longer than PRP. But in both cases, it's helping regenerate cartilage essentially in there, or at least improve the cartilage health in there, decreasing in inflammation in the joint, and just improving healing. So we find those things to be helpful when it comes to arthritis. Where it's not helpful is where you got a structural problem like an ACL tear, and then you got an unstable joint. Okay. And then it's not going to do anything to stabilize the joint. But it can be done in conjunction with that to decrease the inflammation and improve the healing post-operatively.
Now, how long have you guys been doing that? The stem
I would
cell?
say 5 to 6 years, 5 to 7 years, something like that. One of my colleagues here is who does the bulk of it, Dr. Preston Ayers. And he's, we've had some, I will tell you, we've had some really, really tremendous responses, and we've had a couple, it's a little hit and miss. You just don't know what you're going to get. My own dad had PRP done on his hip because he had two friends that had PRP, and it changed their lives. I mean, it just made a huge difference for them. He had it done, and he thought it helped a little. Didn't, not a ton. So it's a little hit and miss that way, but we've had more hits than misses for sure.
Interesting. Well, that's
That would
good.
probably be good for your knee, Wade.
Come on in.
Sounds-
We'll shoot it up.
Yeah.
We can video. We can do a live podcast
Ah,
of
there
you
we
getting that
go.
done.
I spent enough time in Ryan's office the way it is.
One thing I did get asked, and we don't have to make this a long story. A lot of people are asking about pet insurance.
Yeah.
Is it helpful to do that? Do you have any recommendations on, where they could get it?
Mhm.
And is it helpful for, as far as, what does it help?
Yeah. Remarkably, we have very few people who have pet insurance. I think it's something like less than 2% of our 2 or 3% of our clients have pet insurance. It's just like any other insurance. I mean, if you have something go badly, you're dang glad you had it, right? And if things go well, you end up on the losing end of it. The ACL surgeries we're talking about, cost, per knee, $3,000, $4,000, depending on what surgery's done. If that happens, you're absolutely way, way, way ahead by having your insurance. The insurance industry is a little bit different thankfully, in the veterinary world than it's the human world. We actually don't have we have very little interaction with the insurance companies. They don't dictate how we do anything, which is great. It's really more, the client has a relationship with the insurance company, and then the insurance pays back, pays the client back essentially. Most people that I know that have had health and pet insurance, I don't know if I've ever had somebody say to me they regret having health insurance for their pet. I mean, I've had plenty of people say, come in and we have a major thing, and they say, thank goodness we have pet insurance. So there's 3 or 4 companies that do it. It's hard for me to say. I guess I wouldn't feel comfortable saying which ones are better, because I just, I don't have a lot of direct, thankfully don't have a lot of direct relationship with them.
Do they have to have a certification through a certified vet before they let you have it?
I don't believe they do. Now, what they can do though is they can request the records, and so if there would be things it's a pre-existing condition if it's in my chart, right? And so if somebody has a 2-year-old dog and they go get health insurance, the first thing that health insurance, and the client okays it, but the first thing they're going to ask is for the medical records. So then we submit to them. That's the one interaction we have, is then we'll either provide for the client or fax or email to the insurance company our medical records. So that's gonna show any pre-existing things.
Okay. Another thing we wanted to touch on was Lyme's disease. There's a lot of different tests. There's a lot of different vaccinations. What is your thoughts on that?
Well, Lyme has got a lot of. It's a few years ago. It's maybe been 8 or 10 years ago. Several labs developed chair-side tests or table-side tests that test for Lyme disease. Okay, so, and it's usually in coordination with a heartworm test. So people are used to coming in once a year for their heartworm test. in that test now. And in fact, ours is what's called a 4DX test. So it tests for heartworms, Lyme, Ehrlichia, and Anaplasma. Okay, so those last three are 3 tick-borne diseases. And Lyme is the most common one and also the most problematic one. And what that tests, if it's positive for Lyme, it shows us that dog, it's an antibody test. So it shows us that dog has had previous exposure to Lyme disease, or to the Lyme bacteria. So essentially been bitten and infected by a deer tick that had Lyme. The thing about that is that only about 15 to 20% of dogs who have been bitten by a Lyme infected tick and are Lyme positive ever go on to develop clinical disease. And so, but what we know from this is that Lyme is that you can find, you can Google incident like Lyme, that all that's tracked. So we put that into a database, and so all that's tracked. And so you can see the hot spots of Lyme disease, and you can see an incidence map of Lyme disease based off of that. And so it's there's a lot of Lyme out there. So I think what the take home from that is, if I like my dog, I vaccinate for Lyme because I know how prevalent it is there. I see deer all over the place. They're carrying deer ticks. The vaccine is pretty good. It's not perfect, but it's pretty good, very safe. And it's just one less thing to worry about, because that 15 to 20% of dogs who do get clinical disease of Lyme disease, it can be pretty nasty. And usually joint pain and fever, but up to, I've seen a dog die of kidney failure from Lyme disease. So it can be nasty.
So that's important.
And I know
That vaccination.
Yeah,
really
and
is.
I know it hits the reproductive system on them too. So I have a friend that had a dog get it, and he's was a prominent stud dog, and now he's completely sterile. So.
Yep, exactly.
And a big thing we see in the bird dog world is obviously grass-ons, and if you want to talk about that a little bit.
Yeah, we see, those are always the kind of, we'll see grass-ons in the eyes, behind the third eyelid. Those are, and I'm sure you guys have seen that, dogs miserable, they got their eye held shut. It's so painful. Those are kind of rewarding because you actually just put a little local anesthetic in the eye and go pluck that out of there and just give them immediate relief. But then, remarkably, we'll see, things, foxtail up a nose, that kind of thing. And whenever somebody has a dog that's sneezing or having discharge from one nose, they're always certain that there's something up there. I would tell you there often isn't, or if it is, it's a polyp or a tumor or something like that. It's not some foreign object, but we will see dogs that will just do that. And there's a picture, that's the very tail end of a scope. That in the end of that instrument is a rhinoscope. And so that was up, about 3 inches. That's the end of a foxtail we're pulling out. So they just took a picture as they're pulling it out. But that scope went up there about 3 inches to find the end of that. And then what that picture doesn't show is we just keep pulling that out. That was probably 6 inches long. Just really, those are the kind of the days where you're, that was pretty cool. And of course that dog was miserable and then had immediate relief. And I think that was even one where the person even said to me, I think there's something up there. And I said, well, everybody else thinks there's something up there. There's probably not, but we'll look. And then by God, there was.
And those seeds, even they can poke them in the sides or anywhere, and they migrate.
Yeah, and that's the real scary ones is, they might, where something big like that's it's going up there and it's not going anywhere else. But this little seed, little weed on or things like that, they can inhale into their lungs. And like the worst one I've seen is a dog that, and I've seen this actually a couple of times where they got, big abscess in their lungs, and I bet needed a CT scan to find it, but that had actually gone down the lungs and created a big abscess in the lungs. Or I've had a dog where they got that happened and then it migrated out the body and they got a wound in their side. And so, yes, we can absolutely see, even my brother's dog had one that migrated through the esophagus, out into the throat region. I had to go in there surgically and get it. So you wouldn't think those would do that, but they can really be a problem. They're challenging to prevent, though. I mean, how do you stop a dog from snorting up a grass or weed on? You just want to be aware of, if there's anything that just doesn't seem right, that needs to be on our radar.
So kind of the tailgate check after a hunt to make sure you can see the obvious,
Yep.
seeds in the eyes.
Yep,
up in
exactly.
the gums.
Yep.
In their ears, that kind of thing, their feet. So if you
Yep.
check those routinely,
Get out in front of it.
Make it a routine, you might avoid some of those problems.
That's correct.
And Chad's got another question, I believe.
Chad writes, in your professional opinion, what's one thing you see through your experience practicing that dog owners should take more serious? Maybe like some vaccine they should be giving, maybe something like they should be feeding a better feed. Basically, what are you seeing that folks should be doing more on than they are?
Yeah, that's a good question. Probably the one thing that just comes to mind, probably if I thought about this longer, I might come up with something else. But what comes to mind is, a physical exam every year is really important. Even twice a year would be great, but there's a limit to what a physical exam is going to find, right? And so I think it's a really good idea when dogs start to get toward those senior years, and maybe for depending on the breed, that's a different time frame. Small breed dog, that might be 10, 11. For a large breed dog, that might be 5 or 6 or anywhere in between. When they start to enter those senior years, I think periodic blood work to look for these things that we can't find on physical exam, I think is underdone. And it's certainly what you do with your own health, right? There's finding kidney disease early, we can make a huge impact on how long a dog lives, that kind of a thing. Or finding a liver condition early on, we can have such a big impact rather than wait until they're off food now and they're not eating and something, and then it's off the rails, And there's a newer test called an SDMA test, made by a lab called IDEX, and now there's I think a couple of the other companies have come up with their own version that it finds kidney disease 3 to 4 times faster than the previous tests we had, 3 to 4 times earlier. So I think senior blood work I would suggest once a year, on these dogs, once they start to enter their senior years, can really pay dividends in getting ahead of things and finding conditions sooner so that we can have a bigger impact on how we can help them.
When you're saying a senior dog, are you saying like 7?
Probably
and
for
older?
most hunting dogs, I would say 7 to 9 would be the when I would call them senior. That would be kind of a general time frame for those.
We had somebody that asked us one time about any kind of medicine, any kinds of like over-the-counter things that we as hunters could carry with us that
Mhm.
might be like an emergency kind of a trauma thing that we could use in certain situations. Is there anything like that that you would recommend that we
Mhm.
would have with us to treat dogs?
Medication wise, you
Well,
mean?
they get stung by something,
Yeah.
or
Yeah. Yeah.
obviously we talk. A lot of times if a dog gets a severe cut in its leg and gets an artery, that can really be
Yeah.
difficult to
Yeah.
to
Yeah.
stop.
I think
So
the allergic reaction thing you're talking about is probably having Benadryl on hand, and the dosage for Benadryl is a milligram per pound essentially. So 50-pound dog's going to get 50 milligrams, which would be 2 tablets, and you can always round up, right? I mean, if you gave a 55-pound dog 75 milligrams is fine. And so I think having that, when you have these, if you avoid some, pretty dramatic, edema type, swelling type things would be a really good idea. When it comes to like pain control, that kind of a thing, it's a little tougher, because like, for example, aspirin, when given in proper dosages is relatively safe. But the problem with it is then you come in to see me the next day to deal with something, and now that inhibits what I can prescribe, because of some interactions. And so, you know, that I think is not quite as good an idea. But I think having some Benadryl on hand, there's just, if in doubt and you give it, you're not going to hurt anything. It's super, super safe.
Yeah.
I had a couple older dogs that, had a little bit of, they're just old, and they get
Yeah.
sore and it takes them a little recovery time. So my vet had prescribed me some Rimadol that,
Yeah.
if we had a long day of hunting, and I still have a lot of it left, and
Yeah.
it's probably past its expiration date. But if I know a dog has gone hard,
Yeah.
and you're on
Yeah.
a
And a
hunting trip or
single,
something,
yeah.
I kind of
And
maybe.
yep. And that's more of a prescription product, but a lot of veterinarians are fine with having, having their clients have just a little bit on hand. And if you were giving that long term, you'd of course want to be monitoring it. But
Right.
yeah, given a dose or two when they've had a long day, is a relatively safe thing to do, and certainly very effective.
Oh, that's,
one of the things I was going to bring up too was a lot of the guys we know. I used to do it, don't do as much as I used to, but travel out of state with our dogs to hunt.
Yeah.
I know there's a process of getting some documentation to take with you, you
Yeah.
know, showing your rabies and
Mhm.
everything. What's the status of that? How does that work state to state?
I mean,
And
technically,
do you do that much?
a little bit. Technically, if you go to South Dakota, you're supposed to have a health certificate, and that would be something that I provide for you. I have to do a physical exam. I can't, I have to do the full physical exam,
Right, right.
sign the certificates, got their rabies status, etc. Um, that's technically what you're supposed to do when you're crossing over a state line, is my understanding. And I think there may be some variation state to state. Now, I would tell you, I don't know. You've had dogs outside the state many times. Have you ever had anybody ask for a health
Never.
certificate?
Never
Yeah.
have. But
I
Yeah.
had a friend that lived in Colorado and came back and forth from Iowa. He got pulled over for speeding,
Okay.
and the state trooper asked him if his dog had
Is that
he
right?
had his information,
Really?
and he
Yeah,
gave him a
I mean-
ticket because he didn't have his rabies. But
Really?
a lot
Yeah.
of places, and I would suggest, and I have my vet do it, and where I'm at, and they just email it to me. So if I did get asked, you got dogs in your truck, yeah,
Yeah.
you have a
Haven't,
vet? It's right
yeah.
here.
having proof of your vaccination, proof of rabies vaccination is easy. And I would definitely have that. And that's easy. Your veterinarian, like you say, your veterinarian can just email you those documents and you just got them. The health certificate thing is technically you're supposed to, and we're happy to write them up for anybody who wants them. I just don't know how often that kind of thing gets checked. My gut feeling is
I never
pretty
have, but
infrequently.
I guess it
Yeah.
always is kind of nice knowing that you do have it in case
Yeah.
that.
Yeah.
I always was concerned that your dog got injured and you went to a vet in South Dakota or someplace. What
Yeah,
could
I think
happen
they'd like to
then?
have the vaccination history. I don't know that
Yep.
they'd sweat a health certificate too much, but I think they'd like to have a vaccination
I'm
history.
guessing they would email your office and ask for records
Yeah.
or
Yep.
confirmation of
Yep.
what vaccinations the dog has. But anyway,
Yep.
I just thought that's something that I know we've done in the past, and I don't know that many guys ever bring that up or talk about it. So I didn't
Right.
know how common that was. And
Well-
I think there's a fine even if they really want to
Yeah, I think
come
Yeah.
down on you.
I think
that-
if a DNR guy walked up and asked you for it and you didn't have it, I definitely think there's a fine associated with it.
And I have been checked by DNR in South Dakota, and they've looked
They
at my
didn't-
gun and my ammo, but they never ever said anything about the dog. So
I'll be
I don't
danged.
know.
And I
Yeah.
think a lot of them know that, we're out here hunting with dogs. They know we're taking care of them.
Yeah. Yep.
There's probably very few guys. I mean, you might have the old farm dog that runs along with you and runs ahead of you and might scare something
Well, it
up
might
for
be
you.
that we're buying that $150 license and they want us to come back. Too.
Yeah.
I don't know
Right,
about that,
right.
but,
Right.
We talked about the traveling. I know a lot of people, and I've run into it, they got a great hunting dog and they can go the 15, 20 minutes to their spot. But, if they want to drive out to Kansas 7, 8 hours, dogs get car sick
Yeah.
and then they get weak. So
Mhm.
as far as hydrating a dog before they leave, is there anything that you would recommend as far as even if we're hunting hard, besides just water for hydrating? Is there something that they can give a dog just to relax it in the truck? I know there's big things in the CBD treats. Some people
Yeah.
say they work. What are your recommendations on hydrating and with hunting and with travel?
Yeah, I think hydration obviously is really, really important in these working dogs. There are products that are designed to have like electrolytes and that kind of a thing in there, but I don't know that it's just like a human athlete. Do they really need Gatorade, or is water going to perform just as well and that kind of thing? So I think just keeping them hydrated with water, that is a good idea. As far as the traveling, and if we sometimes will prescribe trazodone, which is a sleep aid in people, but is kind of have a nice little sedative effect for dogs to make them travel more easily. It can be super helpful for some dogs, and other times people comment that it just didn't do a whole lot, and it kind of depends dog to dog. The big thing would be if you have a dog who has issues with car sickness and vomiting, last thing you want them to do is vomit multiple times and then get a little dehydrated, then go work them hard in the field. And you can give such things as like Dramamine for that. But there is a prescription drug that's, I don't know, 6 or 8 years old, called Serenia, which is labeled for motion sickness. And it's a really, really powerful anti-vomiting medication and really, really safe. And it's just a pill that you give them. It comes a little four pack. I don't think every dog needs that, but if you have a dog who consistently battles motion sickness, that's a pretty easy fix, and I think it's going to help most dogs.
And I think a lot of that is when I go to throw the dogs in the dog box, they know, just in the dog box, they're like, we're going somewhere.
Yeah.
They're excited, and then they get worked up because they've been
Yeah.
in the car for 4 hours. So
we go
Well, and that's why
long-
that's why that sedative that I talked about is only so effective, because adrenaline pushes through a lot of that, and they're
We
really
go on a-
really excited.
we go on real long trips, like long trip of 10 hours on the road.
Hmm.
And you're hunting someplace for multiple days, and dogs are crated or they're in a trailer or whatever. But I know we always have the anti-diarrheal drug that we have in our kit. I
Hmm.
can't think of the name of it right now, but
It might be
I know we got it from
metronidazole.
you. What
It
is
might be metronidazole.
That
Mhm.
sounds
Might-
right. Yeah.
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 Yeah, and
Just
there's also now another product that's a little more natural called Diagel. That's a little, you give them it's just like a tube that you just squirt in. It's like a gel type thing that's not in the prescription category. That we've seen some success with too. So that's also, and that's maybe even that may even be non-prescription. So people might even be able to just get that on their own. That's a helpful thing.
You don't want a dog with that in a trailer that you're traveling across.
No.
country.
No,
I can
I've-
tell you that for sure.
I don't
Yeah.
want it either while I'm across the country. either. Well, if we could maybe get a list of those and we'll maybe email
Yeah,
Will
maybe we
those
could put
a
those
couple of
up.
those, and we'll make sure we put them
Well,
on.
I tell
in
you
the
what,
description.
That's boy, that hour went fast, Ryan. I gotta
Yeah, it
tell ya.
did.
And what's great information. I could talk. I could keep going, and I know that we'll have to have you back at some point, because I'm sure there will be some more questions that'll come in, and
Sure.
there's a lot of different areas that we didn't get a touch on tonight. But we really appreciate you taking the time to come in and talk to us about these things. We think they're very important, and
It's my pleasure. Thanks for
and
having
I
me.
always learn something new every time I talk to you. So.
Yeah, and we appreciate it. And we also want to mention our next week's guest.
Yeah. Next week we're kind of changing the gears a little bit, and next week we have Des Young, the Hunting with Hank creator and producer, and that'll be an interesting show. So if you're out there and you want to hear what Des Young has to say, see us next week, 7:00, and we'll. That ought to be a good show.
Yeah, I'm
looking
excited
forward
for
to
it.
that, too,
I'm
but-
very much excited for
But
it. So
boy, I tell you what, I think that information like Brian was providing though is so important. We hope that if you were watching out there tonight that you got something out of it. If you didn't, let us know. If you've got some other questions, we'll make sure that we get Ryan those questions, and he did a great job. We love having him on.
yeah, it was a great session. I think it's valuable for anybody with a dog to get this information, and we 100% thank Ryan for taking the time out of his what I would guess is a very 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 busy schedule to meet with us for an hour and giving us all this information. So, and it was free. So
Ryan,
once
thank
again,
you very
we
much.
appreciate it.
You're very welcome. Thank you, guys.
Thank you.